Hello, my name's Mike Farren. I'm Customer Development Manager at Bloom Procurement Services, and today I've got Simon Whitaker from ICS Assessments, and we're going to talk about health and social care integration.
Hi, Mike.
Hello. So first question for you, Simon. What is health and social care integration?
It's an incredibly broad topic. Essentially, integration in the guise that we've had it in the last 10 years or so is the process of separate health and social care organisations coming together to provide health and social care in a more coordinated manner. So we might talk about NHS trusts contracting together with a local authority to provide a joint offer for services in an area. We might talk about a community trust and an acute trust in an area joining together to form a partnership to really coordinate that care for patients. There's been a few different iterations and examples of what this looks like, and we've evolved in the space over the last few years. You know, we've had sustainability and transformation partnerships, which have looked at integrating different organisations together and forming that plan. And more recently, integrated care systems. There are 14 currently in the UK that are forming contractual ties to really integrate the space.
Right. Okay. So why has there been a need for providers in this space to integrate?
So there's been a need for the space to integrate. Most of the reasons come back to transactional costs. And I don't mean this in a financial sense. I mean it in a practical sense for individuals, customers. You know, you and I going into if we're in receipt of health or social care in the system. There's a lot of movement around the system that you might experience depending on what your needs are. So, you know, if a patient gets transferred from hospital, you would get a discharge assessment, typically from a nurse. You might have a social worker come in and visit you in the hospital. However, then there's that process of moving you back home or wherever you might go for your kind of onward care journey. You might get another assessment from a provider. You might get a financial assessment from your local authority to ensure that, you know, the finances are matched up in the right way in the system. So there's lots of different disciplines and lots of different professionals involved. Continuing healthcare is another area where, you know, multidisciplinary teams come together to discuss an individual patient. But if they're coming from different viewpoints and coming from different organisations, such as a CCG and a local authority, can be difficult if you don't know the person and you're not working in a kind of local coordinated way.
Okay. So can you give us a brief overview of what the benefits are to the organisation?
Yeah, so for the organisation, improved outcomes for individuals is probably the most pertinent example. And this relates back to the last question around efficiencies in transactions.